I'm Lawson Safley. I'm a general surgeon here at Onslow Surgical Clinic. I am a general surgeon, and that sort of, I wear a lot of hats at the hospital. We do a lot of what we call acute care surgery, so people that come in with things like an appendix, an appendicitis, if they have a hernia that needs fixing, if they have a bowel obstruction, if they have a bowel perforation, something like that. We're the guys in the hospital that typically take care of that. Here in the office, we do things like anti-reflux surgery. So people that have really bad reflux, we surgically correct that. We manage people with thyroid problems, thyroid nodules, thyroid cancer. We do a lot of cancer surgery. We do colon cancer as well. So I use the Da Vinci surgical robot in a lot of my laparoscopic surgeries. It helps to provide better visualization during the operation, and also the laparoscopic instruments, when attached to the Da Vinci robot, help to provide greater range of motion so that we can do things inside the abdominal cavity that we would not be able to do otherwise if we did not have that technology. I really enjoy being able to heal patients. One of the things in surgery is that we actually get to cure certain diseases. That, and I sort of like working with my hands. Previously I did, before I went to medical school, I worked construction, which is where I learned I really like to, build things and do things and work with my hands. And being a surgeon actually allows me to do that. I try to treat every patient like they were my mother or sister or brother or child, because I know exactly what that feels like. I know what it's like to have a father who needs a procedure, and you have to sort of pass them off to these other people that you really don't know. So I try really hard to provide patients with care that I would be expecting of the care for my loved ones. My job is to know what the standard of care is and to provide that standard to patients. And so whenever I talk about patient care, it's really about what things do we need to do for patients to provide them with the best care that they can have possible. What is that, and how do I do that? What we need to do here is provide exceptional care for our patients so they don't have to drive 2 hours, 3 hours away to try to get good care. If you have a surgical problem, we would be happy to see you at Onslow Surgical Clinic. Call and make an appointment with us.